This is part two of my mini series on large intestine bacterial overgrowth. So, in this part, I'm going to talk about some of the signs and symptoms, or the symptoms, actually, not the signs. Signs will be the next video. Some of the symptoms of large intestine bacterial overgrowth. So, when a patient comes into my office, they're talking to me about their symptoms. What are some of the things they might tell me that might make me think, oh, large intestine bacterial overgrowth or LIBO might be something that's going on. Bearing in mind that most of you listening to this video would be, I'm assuming, thinking about this through the lens of SIBO, which, again, much more recognized, much more awareness around SIBO than about LIBO. Kind of looking at it through that lens, when we contrast, well, what does SIBO look like clinically versus what does LIBO look like clinically? Interestingly enough, the symptom list can be virtually identical. So SIBO, of course, can cause gas, bloating, abdominal pain, heartburn, reflux, could cause constipation, could cause diarrhea, could cause nausea. Um, LIBO can cause all of the exact same symptoms in my experience. And then furthermore, there can be symptoms outside of the digestive tract that could be caused by SIBO, such as skin issues, joint pain, fatigue, brain fog, things like that. Bladder issues, things like that. While and LIBO can potentially cause the same types of symptoms. Now, with SIBO, we have a wealth of research studies that have linked SIBO to a lot of different conditions. With LIBO, we don't have those research studies that have been done. So what I'm saying is based on clinical observation. But ultimately, the symptom list can be the same for SIBO versus LIBO. So that's where it can get really confusing for patients and sometimes very frustrating because, as I was saying in the overview video, folks who have been treated for SIBO and they've only had partial recovery or no benefit at all, or they get better but they relapse when they come off of their treatment, can be really frustrating. It's like, I have all the symptoms of SIBO. Why aren't I getting better when I've treated the SIBO and successfully gotten rid of it? Well, if there's LIBO going on as well, then that can be that can be why it's cause the exact same symptoms. So symptoms of SIBO, symptoms of LIBO, they're basically identical. So clinically, so as a clinician, it's challenging because when a patient's telling me, oh, I've got this and this and this symptom, I'm thinking, well, it could be SIBO or it could be LIBO or maybe it's both. And so ideally, what we do is test for both conditions, or in the case where someone's already been successfully treated for SIBO, we go on to test for LIBO. So I'll talk about that in the next video in terms of the testing methodology, but take-home message is SIBO symptoms, LIBO symptoms, virtually identical. Also a lot of overlap with yeast overgrowth symptoms as well, whether it's yeast in the small intestine or yeast in the large intestine. With yeast, there can sometimes be some other clinical clues, like if, say, patients are getting recurring vaginal yeast infections, that's a clue there might be more of a yeast issue in the gut, or the patient's craving sugar a lot, or if eating sugar causes really overblown or really immediate flare-ups, that can be a clue that it might be a yeast issue. Or if there are rashes, particularly like around the perigenital region, or possibly around the mouth or things like that, or maybe thrush inside the mouth. Those would all be other clinical clues that maybe we're dealing with yeast. With other symptoms, like all the symptoms I mentioned, that could be signs of SIBO or LIBO, could also be yeast overgrowth symptoms too. So it's another variable to bring into the mix. Now, clinically, what I've seen, just based on having done many, many, many tests for patients, I've found that I would say that SIBO and LIBO are much more common than a yeast overgrowth. That being said, there is no clinically available test for SIFO, which is yeast overgrowth in the small intestine. So we might be, seeing a lot more of that, or I might have treated a lot more of that than I thought that I did, because my SIBO treatments are going to be good for treating SIFO/yeast in the small intestine too. So I will leave it there for now. If you have any questions or comments about this topic, please post in the comment section below, and I will post about the testing, which would be the clinical signs of, or one of the clinical signs of LIBO, in the next video.